Assalamu alaikum, I'm Dr. Abdul Hakim Jum'a, and in this video we will be covering where collected samples of suspected Ebola virus should be taken. Early identification of Ebola virus is essential. Any person who is suspected of infection with the virus should have specific laboratory testing to establish a diagnosis. Laboratory findings include low white blood cells and platelet counts, and elevated liver enzymes. Ebola virus disease can only be confirmed through laboratory testing. Physicians need to complete an epidemiological investigation form which has a list for serological and PCR tests. Ebola virus is transmitted from person to person through contact with blood or body fluids of an infected person. All healthcare workers need to consider their own safety before taking any specimens. Protected exposure is wearing personal protective equipment while within 1.5 meters contact with all confirmed or probable cases. It is very important that good hand hygiene is completed before putting on personal protective equipment, and removing all equipment must be done correctly and hand washing repeated. Extreme caution should be taken when collecting and transporting samples from Ebola virus patients. Laboratory tests to confirm Ebola virus should only be performed in Ministry of Health accredited laboratories and verified with a World Health Organization accredited reference laboratory. The laboratory must be informed of the potential risk of Ebola virus in the sample so that they can ensure appropriate laboratory containment. It is recommended that if transfer is granted immediately and the patient's clinical condition is stable, not to withdraw blood tests and let that happen in the Ebola designated center after transfer. To confirm the presence of Ebola virus, blood samples from patients should be collected in two types of tubes: an EDTA, CBC blood tubes for the PCR test and viral isolation from plasma, and a plain tube with a red top for antibody and antigen detection tests and viral isolation from serum. At least 2 EDTA tubes and 2 plain tubes should be collected to confirm the diagnosis in 2 independent laboratories. All healthcare workers and laboratory staff must be informed of the presence of potential viral risk in the samples collected for laboratory confirmation. By following PPE principles and exercising caution, we will all work together to reduce the risk of infections.